Good afternoon, everyone. Thank you for joining us. Before I start today, can I say, mainly for the benefit of the journalists on the line, that I will require to end this briefing by 1:30 at the latest, even if we haven't got through all of the questions, which obviously I will try to do. I understand that the COBRA meeting planned for today is likely to take place from 1:30 at any time from 1:30 onwards, so obviously I have to be free to participate in that. Now, I'm going to speak in a few moments about the announcements we made over the weekend, the announcements I set out here on Saturday evening. And I will also reflect on the decisions that have been made and intimated over the weekend by other countries in respect of closing borders with the UK. But first of all, let me begin with today's statistics. The total number of positive cases reported yesterday was 1,504. That represents 6% of the total number of tests carried out, and the overall number of confirmed cases is now 113,050. Now, as you will have noticed, today's figure represents a significantly higher number of new cases than we have seen in recent times. We think that this may be in part down to a processing backlog last week within the UK Lighthouse system. So please be aware that today's figures may be affected by that backlog of cases now coming through the system and being reported on. However, we are doing further analysis of these case numbers today to confirm that. I can also confirm that 1,078 people are currently in hospital. That's an increase of 17 from yesterday, and 59 people are in intensive care, which is one more than yesterday. No additional deaths have been registered in the past 24 hours of patients who first tested positive over the past 28 days. However, as you know, registration offices tend to be closed at weekends, so the figures we report on Sundays and Mondays can be artificially low as a result of that. In total, since Friday's update, 44 deaths have been registered, and that takes the total number of deaths under the daily measurement to 4,283. Every single one of these deaths is obviously a source of heartbreak, and yet again I want to send my thoughts and my condolences to everyone who has been bereaved as a result of this pandemic. Now, I'm joined today, as you can see, by the Chief Medical Officer and also by the Chief Constable. The Chief Constable will, in a moment, talk about Police Scotland's approach to enforcing COVID regulations as we head into the Christmas period. For my part, let me stress again how much I and the Scottish Government values the hard work, professionalism and public service of Scotland's police officers and the staff who support them. These qualities are always appreciated but have been particularly important and valued during the past few difficult months. The main thing I want to do in my remarks today is to reflect a bit more on developments over the weekend, and I'm going to spend a little bit of time on these because I do know and understand how upsetting Saturday's announcements in particular were for so many of you. The first thing I want to do is reiterate the point that none of the actions I announced on Saturday were taken lightly. The analysis so far of this new variant of COVID that has been identified in the UK does give us real cause for concern, because the indications at this stage are that it is much more transmissible than previous strains of the virus. Let me stress again, though, that there is no evidence so far that this new strain causes more severe illness, and I think that is reassuring. Now, further analysis of the new strain is being carried out, so there is much we still have to learn about it. But given what we have been advised so far, it is essential that we take the risk seriously and that we act accordingly. The key lesson of the last 10 months is that if we are complacent in the face of this virus, or if we act too slowly, or if we wait for all possible information and data before making decisions, the virus can run away from us very quickly, and if that happens, the consequences can be very serious indeed. So that is the context for the strong precautionary and preventative action we announced on Saturday, and I want now to turn to some of the detail and the consequences of that. Firstly, let me address the announcements yesterday that several countries, including France, have instituted travel bans to prevent people from the UK entering their countries. Now, our advice for individuals here is already that you should not travel to or from Scotland unless it is absolutely essential. Indeed, travel to and from other parts of the UK without an essential reason is prohibited by law for now. That's a decision we certainly don't take lightly, but it is one necessary to prevent more of this new strain of the virus coming into Scotland. In terms of international travel, clearly most of the attention overnight, for understandable reasons, has been on the decision by France to put in place a ban on accompanied freight traffic, essentially lorry traffic, entering France. Now, France has said this morning that they hope to establish a protocol to enable movement to resume, something that we very much welcome. However, we do not yet know exactly when that will take effect. We do hope that the current situation will improve over the course of the day, but of course, for as long as it pertains, it has significant implications for many businesses in Scotland. It affects the ability of exporters, including our important seafood sector, to deliver to overseas markets, and it also affects our ability to import certain goods and supplies into the UK and into Scotland. I'll be chairing a Scottish Government resilience meeting on this later today, and before that, as I indicated at the outset, I will be taking part in a COBRA meeting chaired by the Prime Minister that will bring the UK Government and devolved governments together to discuss these issues, and we are working very closely with the UK Government and will continue to do so to mitigate any impacts. I've heard calls from our food sector for the UK Government to take a number of steps to enable them to continue to export, and I support these calls. In particular, the UK has planned for port disruption as part of a no-deal Brexit, and these plans should now be activated. We have also urged again the UK Government to seek to extend the current Brexit transition period or to secure a grace period before any deal is implemented to prevent further disruption. I think everybody would accept that all of us have quite enough on our plate to deal with right now without compounding those difficulties by the end of the Brexit transition period. For the moment, though, I want to stress two key points. Firstly, the stockpiles of medicines that were being built up ahead of Brexit are in place. And so while we monitor medicine supply very carefully, we have no immediate concerns about medicine supplies. We are also assured that there is no risk to supplies of the COVID vaccine. And secondly, we have been assured by supermarkets that they are well stocked for Christmas, so there is absolutely no need for people to buy any more than you normally would. I would ask everybody to please support each other and shop responsibly. These are difficult times we are living through, but we have been served well by that spirit of solidarity, and it's important that it continues over this next period. Let me turn now to the decisions I set out here on Saturday. Some have questioned, and indeed I anticipated this on Saturday, the need for these actions given the overall prevalence of COVID in Scotland is currently quite a bit lower than it is in some other parts of the UK. But there's 2 points it's important for me to make about that. Firstly, Scotland's case numbers have been volatile in recent days, and after some weeks of decline, and I indicated this earlier last week, we think they may be rising again. Today's numbers, indeed, even with the caveat I put around those earlier on, show that that may be the case. And because of that, our R number has risen, and after a couple of weeks of it being slightly below 1, we think it is now hovering around 1 again. So even without this new strain, we would have no room for complacency as we head deeper into the winter. However, it is the concern about the new strain that necessitated the very stringent actions that I set out on Saturday. We know this strain already exists in Scotland, although we think it is still at lower levels than in the south of England, for example. However, if it is the case, as early analysis suggests, that this strain is up to 70% more transmissible and that it could add up to 0.4 to an R number already hovering around 1, the risk of it rapidly spreading here, as it appears to be doing in some other parts of the UK, is very real indeed. In London and the southeast of England, it's thought that this new strain might already account for between 40 and 60% of all new cases. So that's what we've got to stop here in Scotland, and that's the reason for the actions that I announced on Saturday. And as I said earlier on, over the course of this pandemic, perhaps the most important thing we have learned, I know it is perhaps the most important thing I have learned, is that failing to act quickly is almost always a mistake in the face of COVID. If we do nothing now, we are likely to see more new infections in Scotland as a result of this variant, placing an even greater strain on our health service and unfortunately leading to more deaths. But as things stand, with our lower prevalence in a relative sense, we still do have a chance of keeping the situation under control while the vaccination programme continues and while we get case numbers back to very low levels again. So that's why we announced action on Saturday on two fronts. Firstly, to try to stop more new cases of this variant coming into Scotland, and secondly, to try to stop it spreading further within the country. In relation to the first of these, as I said earlier, we are maintaining a strict travel ban on non-essential travel between Scotland and the rest of the UK. That ban, which will not be relaxed at all over Christmas, even on Christmas Day, unfortunately, is one of the issues that the Chief Constable will talk about in his remarks. However, since this variant has, we know, already established a foothold in Scotland, we need to reduce the risk of it spreading further here. And we've taken three key decisions to do that. Firstly, we are now enabling indoor mixing between households only on Christmas Day itself and only within Scotland, rather than over a 5-day period across the UK. Fundamentally, though, my advice is not to meet indoors at all, even on Christmas Day, if you can possibly avoid it. If you can, see family from other households outdoors only. The second key decision that we have taken is to impose tighter restrictions after Christmas. We will apply level 4 measures to all of mainland Scotland from Boxing Day morning, a minute past midnight on Boxing Day, for a period of 3 weeks, although we will review these level 4 restrictions after 2 weeks. What that means is that from Boxing Day morning, non-essential shops will close, so will pubs, cafes and restaurants, apart from takeaways, and we'll be asking everybody to work hard to reduce any unnecessary interactions with other households. Non-essential travel to and from different local authority areas will also be prohibited from Saturday. The exceptions to level 4 will be Orkney, Shetland and the Western Isles and the other island communities where we've reduced restrictions in recent weeks. These areas will go to level 3, but again with no non-essential travel to and from them. Now, the third key decision on Saturday was to delay the return of schools after the holidays. Again, a decision we did not take lightly. Everybody knows how hard all of us have worked to keep our schools open from August. And this decision means that with the exception of children of key workers and more vulnerable children, pupils will not return to schools until turn to learning until the 11th of January, and then until the 18th of January at least, schools will be online only. Now, these were all decisions I wish we didn't have to make, and I know they were horrible decisions for all of you to have to hear. I am well aware of the impact that level 4 restrictions in particular will have on people's well-being and on businesses like retailers and those in the hospitality sector. When I went home from here on Saturday night after doing the update, I spent a fair bit of time reading many of the emails I had received. I think it is important for me to do that. And these were from people, many completely understanding of the need for these decisions, but who nevertheless wanted me to know the impact of them on them and on their families. And it is heartbreaking for so many of you. And I want you to know that I do understand that. And if I thought there was an alternative to any of these decisions that we are taking right now, I would take that alternative in a heartbeat. But I know the consequences of not acting now to stop this virus could be catastrophic. So I am genuinely sorry to have to do these things, but believe me when I say they are necessary. We can't take the risk of allowing this new variant to spread as rapidly in Scotland as it appears to be doing in some other parts of the UK. We know that this virus, like all viruses, it exists solely to spread to as many other people as possible. That's how it survives. And what we unfortunately now know is that it seems to have become much more better at doing this through the new variant. So if we don't act now to curb its spread, we run the risk of cases running out of control in the early part of the new year. The restrictions we have put in place and that will come into effect from the weekend give us a much better chance, though, of preventing that happening, while allowing more of the population, especially those who are most vulnerable to the virus, to become vaccinated. And while I know that it's very difficult to hear talk of lights at the end of the tunnel right at this moment in time, we shouldn't forget that the vaccination does give us that hope for the future that we haven't had at any point in these past 10 months. Now, the final point I want to make before handing over to the Chief Constable is this one. Although it appears that this new variant of the virus transmits more easily, it can still be stopped in its tracks. And the way to stop it in its tracks are through the same measures that we have been emphasising and advising throughout the pandemic so far. Physical distancing from people in other households, 2 metres if and when at all possible, washing your hands as often as you can, wearing face masks, opening windows while you're indoors, staying outdoors with other households as much as possible. All of these things still work in reducing the transmission of the virus. In fact, this new variant makes them more important than ever before. So after 10 months of all of us becoming really fed up of all of these measures, it is more important now than ever that we really do try to remember them at all times. That's why we're asking you to avoid indoor meetings on Christmas Day as far as possible. Difficult though I know that is, because indoor meetings are the best possible environment for this virus to spread. And it is why all of us should remember in everything we are doing the facts advice. Wear your face coverings, avoid crowded places, clean your hands, clean any surfaces you're touching, keep a 2 metre distance as far as you can from people in other households, and don't forget to self-isolate and get tested if you have symptoms. I know how difficult all this is. The last 10 months have been unremittingly hard for everybody, and I suspect this next 2 weeks are going to be even harder yet. Time of year when we should be looking forward to spending time with our loved ones. I do know how tough it is, but this is necessary. We must do these things to get us through this next phase of the pandemic while the vaccination programme gathers pace as safely as possible. I can never thank you enough for continuing to bear these sacrifices and continuing to do all of the things necessary to keep yourselves and your loved ones safe. So thank you for all of that. I'm going to hand over to the Chief Constable now, and then I and the Chief Medical Officer will take questions as normal. Chief.
Thank you, First Minister. 2020 has been a relentless, difficult year. Families across Scotland have suffered illness and tragic bereavement and made significant sacrifices in the collective effort to control the spread of coronavirus. I pay tribute to the resilience, the forbearance of the people of Scotland, who have demonstrated overwhelming personal responsibility to do the right thing for the public health imperative. And of course, police officers and police staff have been a key part of that public health response, explaining the rules, encouraging, enabling the high levels of cooperation that we have experienced so far. As Chief Constable, I will always be direct with our fellow citizens, the people of Scotland, to whom I feel personally accountable. So I know and agree the measures have been highly restrictive and at times it can be difficult to fully understand. I also know and agree by necessity the rules have changed often and at times quickly, and that this has had enormous impact on the people right across Scotland. And of course, it's also fair to say the enforcement of these restrictions is not without challenge. That's why I've kept our interaction with the public right across Scotland under daily review, and why I commissioned additional independent and expert advice to understand the impact of the changing legislation on communities to help us apply the law fairly, firmly and reasonably. Our policing principles and approach have not changed and will not change. Officers will demonstrate compassion, empathy and exercise discretion to understand people and help them do the right thing. And equally, as our communities expect, where there is willful, persistent, blatant breaches, we will continue to act decisively and enforce the law. This has already been evident in our very firm position on house gatherings. Such gatherings can have a significant influence on spreading the virus. They are against the law and they should not take place. Similarly, following the announcements from the First Minister on Saturday, there can be no doubt that other than for essential journeys, people should not be travelling between Scotland and other parts of the UK. Public safety, public health requires that. Additionally, travel restrictions between local authority areas continue to apply, and from Boxing Day they will be increased to a blanket travel ban right across the whole of mainland Scotland. I remain clear. I do not consider it appropriate, I do not consider it proportionate for officers to establish checkpoints, roadblocks, to simply enforce these travel restrictions. I want to clearly outline, nevertheless, what people can expect. I announced yesterday I've authorised a doubling of our operational presence on the roads in the border country, as well as an increase in patrols across the whole of Scotland. A single national force, we are able to quickly flex resources and provide the presence required. Highly visible patrols, proactively deployed on our networks, will deter people who might be considering breaching the travel restrictions. I underlined a few days ago at a previous briefing devastating consequences that drink and drug driving have had across many generations in Scotland. And these patrols to prevent people travelling will also continue to ensure road safety. Now, from the time of the very first restrictions in March, the vast majority of people have done the right thing. I am hugely grateful for that support, hugely grateful for that cooperation. All of us must continue to follow the rules. And as a result of that, I do expect the roads to be quieter than usual over the coming days. Now, taken together, this will mean greater police presence and visibility, and thus greater potential engagement for citizens with police officers over the festive period as we continue to support this public health emergency. I want to underline that these duties will be carried out by dedicated officers and staff who, as always at this time of year, are working to keep people safe. I again pay tribute to officers and staff and their families for their commitment to public service. I would make a personal plea to the public to continue to support them. Now, our relationship of trust with the public is the foundation of policing in Scotland. I am hugely grateful that during this year of adversity, that bond has been further strengthened. Finally, we all know that for some people, the Christmas and New Year period can be particularly difficult. They can feel vulnerable, lonely, and at risk of harm. Protection is a priority for the Police Service of Scotland. It lies at the heart of our values. It lies at the heart of our mission to keep people safe. If you or anyone you know needs help, please contact your police service. We are here 24 hours a day, 7 days a week. We are here to help. Please take care of yourselves and take care of each other. Thank you.
Many thanks indeed, Chief Constable. We'll now move straight to questions, and the Chief Medical Officer is here obviously to answer questions about the new strain of the virus or any of the other clinical issues involved. Firstly, Peter McMahon from ITV Border.
Good afternoon, and thank you, First Minister. I wonder if I can ask the Chief Constable, following his statement there, the law didn't change on Saturday. Does he consider that the level of fines are appropriate for what he describes as deterrence? And for people in the south of Scotland, when he says that they are going to double the number of patrols, what does that actually mean? From what to what? Will it be a substantial number of patrols? First Minister and the Chief Medical Officer, we've had a statement from NHS Borders and NHS Scottish Borders Council today saying it's still possible that the new variant of COVID could be in the Scottish borders. I wonder if you have any more information on that. If it's the case, what can you do about it? If it isn't the case, are there some more restrictions you can possibly place on travel, England-Scotland border, or perhaps within Scotland to try and stop it coming into Scotland?
Thanks, Peter. I'm going to hand over firstly to the Chief Constable. I'll maybe say a word or two, and then I'm going to hand straight over to the Chief Medical Officer to take your second point. But the first of my chiefs here, I'll hand over to Iain Livingstone.
Thanks, Peter. In regard to the level of fines, our experience is that that hasn't been a major driver in terms of people's likely level of compliance. The first thing is that people want to do the right thing because they know it is the right thing to do. And in terms of the increase in presence that people will see right across Scotland, but particularly in the border country in terms of the local authority areas, the Scottish Borders and Dumfries and Galloway, there will be a significant increase in visible presence. Now, as I said, I also expect there to be a reduction, if you like, in the public being on the roads and moving around. And therefore, my expectation, my hope and my intent in terms of doubling the number of resources is that actually you'll see a really significant impact. And if anybody has any sense that actually I'm going to chance it because I want to do it, what I would say, don't do that. Don't do that, not because you might get stopped by the police, although you might, and we will be very visible and we will be engaging with people who are on the move. Don't chance it because you're putting other people at risk. And you are right, the rules haven't changed. The reason that we have increased our resources is because of what we've heard from the First Minister and the Chief Medical Officer. We are doing this in response to the public health imperatives, and that underpins and underlines the approach policing's had right from the outset. This is about public health, keeping people safe.
Thanks. For me, before I hand over to the CMO, you're right, Peter, the rules haven't suddenly changed in terms of cross-border travel, but as the Chief Constable has just said there, what has changed is that the public health reasons for this has gone from strong to even stronger. And it has been important, people should obey the law anyway, but it has been important to limit cross-border travel. It is much more important now because of the necessity to try to limit further importation of this new strain to Scotland, and I can't stress that enough. I would also absolutely agree with the Chief Constable. The biggest deterrent any of you should feel against travelling across the border right now is not fines, it's not police enforcement. All of that is necessary and important, but it should be the risk of getting this virus. And even if you think you would be fine, the risk of passing it on to others and bringing this new strain into Scotland, and that should be the biggest deterrent of all. But I'm very grateful to the Chief Constable for his operational response over the weekend, which helps us to underline the importance of this message. The Chief Medical Officer will say a little bit about the work that has been done both through genomic sequencing and other ways to help us identify cases that are of this new strain. Some of that takes some time, but there are other steps being looked at right now. We, as I said on Saturday, are particularly keen to understand whether it is circulating in hospitals and care homes, and the borders is absolutely at the top of that list, given what we are seeing around the nosocomial infection in Melrose in particular. But the main way of mitigating against this is for people to obey these travel restrictions and not travel across the border. If you require to travel across the border for essential purposes, then it is absolutely vital that you stringently follow all of the public health advice, encapsulated, of course, in facts. But I'll hand over now to the Chief Medical Officer.
Thanks, First Minister. So, Peter, there's, as you would imagine, there's a lot of work that's currently underway, led by Public Health Scotland, looking to see if we can determine just the extent of any cases of this new variant across Scotland. That's been taking place over the last few days, and it will continue over the forthcoming days as well. There's two broad strands of work that are currently in play in relation to this just now. The first is to step up the number of genomic sequencing that we're doing to try and establish very firmly any links to particular areas across Scotland. And we can do that as well by honing down particularly on some of the PCR tests we've already got in the system. One of the features of this new variant when we look at it is that when people undergo PCR testing under one of our particular platforms, there's what's called an S-gene dropout. Now, this is just the way that this test is reported and appears as it goes through that platform. And some other mutations do this as well. But if we focus on this particular S-gene dropout, we might start to get a much clearer and faster picture of the extent of any spread across Scotland just now. That work's underway at the moment. I expect to hear more information from Public Health Scotland over the forthcoming days. Also, we should receive further information from genomic sequencing over coming days as well, and then we'll be able to firmly establish the extent of any spread across Scotland. We certainly have more detail about that, but my message is very, very clear here. It doesn't matter whether you're in Melrose or Motherwell, the same protections apply. We should all assume that we could come in contact with people with coronavirus, whether it's this new variant or the older variant, and take the simple steps that we know can help to prevent infection. That's making sure that you keep your distance to 2 metres when it's possible, to make sure you're wearing your face coverings in all the circumstances where you might come into contact with people that you don't know, and to make sure that you're clearing your hands and surfaces round about you regularly. These are the simple steps that we can all take every single day to make sure that we're limiting the ability of this new variant spreading across Scotland.
Thanks. Laura Alderman from STV.
Good afternoon. Thank you, First Minister. We know on Boxing Day that mainland Scotland will be placed into Tier 4 restrictions for at least 3 weeks. But given that this period is so crucial for businesses, especially things like retail and hospitality, can you give any guarantees today of when these restrictions might be lifted? And I'd also like to ask the Chief Medical Officer if at the moment we have any concrete figures of exactly how many positive cases of COVID in Scotland are a result of this new strain.
I'll hand over to the Chief Medical Officer probably on the number of cases. I'm not sure the Chief Constable would welcome that question. I can't give those guarantees right now, and I hope people will understand why not. We are dealing with an unpredictable development in this pandemic. Now, I hope that a week or 2 or 3 weeks from now, we will have much greater clarity about the characteristics of this new variant. Call me a hopeless optimist if you want, but I will retain the hope that maybe as the analysis develops, some of the findings around that will suggest that maybe some of our concerns are not as don't have to be as serious as we think they are right now, but who knows whether that will prove to be the case. Right now, we know that this new strain presents a real risk of much faster transmission, so we've got to act accordingly. These level 4 restrictions will be in place for 3 weeks. We will review them after 2, and we will set out at that stage and obviously keep people posted as far as we can along the way. I've asked the Finance Secretary to review the levels of support we have in place for businesses. Obviously, the support that is already in place will continue right through any duration of level 4 restrictions, but she is looking to see at what more we can do to help businesses within the resources that we have available to us. I'll hand over to the CMO on what we can say right now about the prevalence of this new strain in Scotland. We think it is at lower levels than in the southeast of England, for example. The number of identified cases is small, but as I said on Saturday, we also think that is likely to be an understatement of that, because not everybody is tested, and not everybody who is tested has their test been put through genomic sequencing. One of the things that I understand, but Gregor can say more about this, is the UK does more genomic sequencing than almost any other country in the world. And therefore, it may be that it is that greater genomic sequencing that has identified this strain in the UK earlier. And it may be in other countries as well. We simply don't know that. But there's a lot of work going on to try to understand it better. And that work, I know, is happening at pace.
We're a very sophisticated network across the UK that's been leading this genomic work and trying to identify new variants of this virus and the mutations that we associate with the virus since the beginning of the pandemic. It's important to realise that all viruses mutate, all change over time, and what this collaborative of different academic institutes and public health institutions have been doing is trying to identify whether any of these mutations are significant, and that's why this one has been discovered just so early. We probably contribute proportionately far more than any other country in the world to the worldwide database of the genome. And in Scotland just now, we've got a number of different institutions who play into that as well. The work just now is concentrating on whether we can identify further samples that meet the case definition that has been developed around about this new mutation. Just before I stepped onto the podium today, I had a conversation with colleagues in Public Health Scotland, and they were able to tell me that the current figure for Scotland is we have 18 cases who meet this case definition. That's an additional one from that which we reported over the course of the weekend. All of those are associated with the central belt, but I and others would feel that this is quite an underestimate of the likely cases that there are in Scotland, particularly because it's a sample of cases that are subject to this type of surveillance that goes through the genomic sequencing. That's why it's so important to establish whether the S gene dropout that we see sometimes occurring in PCR can be closely associated with this particular variant. If it is, we can use that as a proxy test to identify the variant over time as well. That work will continue to be ongoing, but what I know of the identification of that S gene dropout in Scotland just now is that we've got far lower proportions of that than other parts of the UK at this moment in time.
Glenn Campbell from BBC.
Hello, First Minister. Thank you. First Minister, you've made the case for swift and decisive action, but given the seriousness of the situation, people might wonder why it's still possible to meet with others on Christmas Day, why the toughest restrictions are not taking effect until Boxing Day, why it's okay for our kids to go to school this week when that may not be the case in the early part of the new year. And to both you and the Chief Constable, given many countries are closing their borders to the UK, what should be the position on our international border?
I'll hand over to the Chief Constable in a second. He will have operational comments, no doubt, he wants to make about that. I'll deal with it in a policy sense. We are continuing, as I think I said this on Saturday, to review the arrangements for international travel, and I'll set out more detail on that if we are taking further decisions. We already, of course, operate a quarantine arrangement, but this new strain, as it is doing across all of our responses, means that we need to look at that afresh. So these are always finely balanced judgments we have to make. I've said before, and I'll say it again, making sure you're acting in a way and at a speed that is commensurate with the scale of the challenge you face is really important here. Because we have lower prevalence by some considerable distance in Scotland than other parts of the UK overall right now, and because we are confident that while this new strain is in the country, it is at much lower levels. It gives us not much time, but a little bit of time to manage the phasing in of these changes, and that's what we're seeking to do. Although these changes have started already, we are already emphasising the importance of the travel ban. We are already making sure that we are emphasising the importance of all the other restrictions, and we have already significantly changed the proposed arrangements for Christmas. And on your point about Christmas Day in particular, my advice to people is not to visit indoors with another household on Christmas Day. The reason that we have left that is the same rationale as the rationale behind the 5-day flexibilities earlier on. We know, and I talked earlier on about looking at my emails on Saturday night. We know that there are some people who simply feel they cannot leave a vulnerable older person on their own on Christmas Day. So we are giving that flexibility, but advising people only to use it if absolutely necessary and narrowing it much, much more significantly. If you have to see people on Christmas Day, please do it outdoors and restrict indoor mixing as much as you possibly can. On schools, the position on schools, so by the middle of the week, all of our schools will be closed. In fact, I think 10 local authorities are already closed to children, and 22 close between today and Wednesday. So I think for one council, the last day is today. 12 have the last day tomorrow, and there's a small number who have a last school day on Wednesday. Again, we've taken account of all of the public health advice, the overall situation we're in, and we think that phased approach into the Christmas period is a reasonable one, with the restrictions that I set out on Saturday, then progressively from now through the week and into the weekend coming in. Now, we can do that, we think, because of this low prevalence, but we can't take longer than that. So these are finely balanced judgments that we have come to that we think help to manage the whole period, the whole situation as carefully as we can. Chief.
Glenn, thanks for that. I mean, as you know, in terms of international borders and immigration rules, movement rules, that's a reserve matter to the United Kingdom government. I mean, I'm looking at the screen now, and I can see it looks as if you're either at Edinburgh Airport or Glasgow Airport, and you will see there that there will be a visible police presence, and that people are travelling for a legitimate reason. Now, obviously, in terms of the public health imperative, heard both from the First Minister and from the Chief Medical Officer, that actually less travel is best. That's what we're seeking to do. But any decision around international borders is clearly not one for myself as Chief Constable. We'll continue to respond very quickly, as we have done, to any changes that might arise.
Alan Smith from Bauer.
Thank you, First Minister. Following Joe Fitzpatrick's departure as Public Health Minister on Friday, you've moved to appoint a minister directly responsible for drug policy. I was just wondering if you're given any more consideration now to appointing a minister responsible for the rollout of the vaccine? And secondly, if I may, you talked about the impact all of this is having on people's mental health. We spoke with the Children's Commissioner in Scotland on Friday, who said that the challenges faced by children had been amplified as a result of the pandemic, particularly in mental health. And given that CAMHS was stretched before the pandemic, he says that children are essentially needing to get to crisis point before they get access to services. And following the announcement on Saturday, Rory O'Connor, the Director of Suicidal Behaviour Research at Glasgow University, issued an urgent plea for more resources to be invested in child and adolescent mental health and warned that inequalities are growing day by day. Will we see more resources diverted to this?
2 points that I'll quickly take, both of them. The Health Secretary is responsible for overseeing the rollout of the vaccine. Ultimately, of course, the buck stops with me, but the Health Secretary is engaged on this on a daily basis. I will later today appoint a new Public Health Minister who will obviously also be involved in that, as in the range of other issues. And I'll set that out later on today. As I'm sure everybody can imagine, there have been a number of things vying for my urgent attention this morning, not least the issues we'll be discussing at COBRA and at the resilience meeting later today. I absolutely not just understand but agree with the concerns about the impact of this pandemic on children. It's why we have been so determined to keep schools open as far as possible, and notwithstanding what we've said for the first part of January, we are really determined to get schools back full-time as normal as quickly as possible, because for every day that children are out of school and not living normally, it has an impact on their education, their welfare, their development and their mental health too. The Mental Health Minister has already set out the Mental Health Recovery Plan. Before the pandemic, and this is even more the case now, we have a big focus on not just investing more in child and adolescent mental health services, and as we go through the budget process in the next weeks, I think you will see that commitment in terms of resources, but also in redesigning how we deliver CAMHS services to young people, so that there is much more of an emphasis on prevention and early intervention, which is why we're creating the wellbeing service, putting counsellors into schools, so that the specialist CAMHS services are there for those who genuinely need those. So that is work that was underway before the pandemic, and the impact of the pandemic means that it is more important than ever, and that we're working to accelerate that as far as possible. Phil McDonald from Global.
Thanks, First Minister. Are there any plans to reintroduce shielding in Scotland off the back of this new strain? And just to the Chief Constable, to pick up on what Peter was asking, is it possible to put an exact number on how many officers will be on patrol in the borders this Christmas?
I'm going to hand over to Chief Medical Officer, who I know has been looking at the issues on shielding. I think we will issue a statement on shielding later on, but he'll cover some of that, and then I'll hand straight to the Chief Constable.
Yeah, thanks, Phil. So we've been kind of keeping a close eye on the situation in terms of advice to those who formerly shielded in the earlier part of the year, and there's well-established advice that we have provided as people experience a different level or tier in their particular area. When we move to that level 4 or level 3 advice across Scotland, what will happen is I'll write to all of those people who have shielded in the past, who are on those lists, and give them specific advice about the steps that they can take to make sure that they can reduce their own risks. You'll recall that one of the things that we've tried to do is to make a broader assessment of actually the risks of shielding as well, because we know that it's an incredibly difficult thing for individuals to undertake as well. It has quite an impact both on their mental health and also on their physical health as well. And so there's a finely judged balance between giving them advice to be able to enable them to make those decisions for themselves, to make sure that they are aware of what the risks for them might be, but to enable them to continue for as much as a normal life as possible during the time that there may be an increased risk from COVID as well.
Just as a point of operational principle, I would never specifically comment on exact numbers, but what I would say is this, Phil, that Dumfries and Galloway is V Division, Scottish Borders are part of J. Juliet Division in the Police Service of Scotland. But in addition to those two territorial divisions, we also have our national roads policing team, and that is where the main arterial routes you will see a significant presence. I was again speaking with members of my command team this morning about our ability to have operational plans in place to allow our flexible response unit to be deployed and to make sure that as many of the national assets that we have in our single service are brought to bear. And what I can tell you, I know immediately that there was significant number, even as of yesterday, in terms of our road policing vehicles on the main arterial routes, making sure there was high levels of visibility. The challenge for us, and it's one again we've started to work upon in terms of our operational planning, again the benefits of operating as a national entity, is making sure that we can put in place a model that's sustainable. It's not just for this initial period and into Christmas and over Boxing Day. It's actually into the new year to make sure that that high level of visibility that I hope you will see continues, and that through that visibility people will not travel as has been asked of them.
Right, I'm going to move on. If I can remind everybody of what I said at the outset, we've got a hard stop of 1:30 today, so I will try to accelerate and get through the remainder of the questions as quickly as possible so that we do get through all of them. Emma O'Neill from PA. Emma, are you there?
Oh, yep, sorry, can you hear me?
Mm-hmm.
Great, thank you, First Minister. Is the decision to move to remote learning a recognition that there could be transmission in schools? And are we likely to see remote learning continue for several weeks as opposed to just one?
Sorry, Emma, you were breaking up quite a bit there, so I didn't hear you completely. I think I got the gist of the question, but apologies if I'm about to answer a question you didn't ask. I think you said, is the move to remote learning an indication that we think transmission is a greater problem in schools, and is it likely to be more than the 2 weeks? Firstly, no. I mean, the Chief Constable, the Chief Medical Officer, my apologies, I'm getting my chiefs mixed up too often today. The Chief Medical Officer might want to say a bit more about that, but we haven't changed our views on the transmission risks, or in our view, the relative low risk in schools, but this is a recognition of just the overall situation in the country that is necessitated because of this new strain. We have said very clearly, at least until the 18th of January, there will be remote online learning, but we've equally said we are determined, if at all possible, to get schools back to normal from the 18th of January. We are simply being clear at the moment that given the nature of what we're dealing with right now, we can't be absolutely certain and definitive, but we will keep parents updated. There will be guidance about how the first couple of weeks of school will operate, issued very soon to help parents and others to understand that, but we will keep people updated as much as possible as we go through these next 2 weeks. Do you want to add?
Yeah, we work with authorities, particularly in the south of England, but across England, to understand the transmission patterns associated with this new variant. At this moment in time, there is no clear signal to say that children are any more likely to transmit it than before at all. It seems to be, and across the age groups, that there's increased transmissibility. So it's not in response to that, it's just to make sure that we limit the opportunities for any transmission at all at this point in time. It's very much a precautionary approach.
Derek Keeley from the Courier.
Thank you, First Minister. What specifically is being done to help Scottish producers who have trucks heading right now to Europe with livestock, shellfish, seafood? And will there be any kind of compensation or financial support available? I know that's something that's been called for. And very quickly, can you also give a bit more detail on what caused the lag in case figures? Is it the same data transfer issue we saw before, or is it something else?
It has been a backlog in cases coming through. As I understand it, because of spikes in demand in some parts of the UK, it has, as I understand it, I look at these things carefully, that has resolved itself, but we're just catching up with some of that backlog, which may be feeding into the figures we saw yesterday, which were a bit higher than they'd been, but also these figures today. But obviously we're doing further analysis of that. When we report figures on a daily basis, we're reporting them on the basis of the date of the test result. What always happens is then, cases are sort of reconciled to the date of the test sample being taken. So that then allows us to see whether they all even out or whether there are actually any spikes. And it takes a couple of days for that analysis to catch up. On the first part, I don't want to get ahead of ourselves. The biggest thing that we can do for our exporters and businesses who are exporting, and particularly right now, I know that the most acute concern is in our seafood sector. is to get that freight traffic moving again. And that's why the announcement earlier on by the French government that they were looking to get a protocol in place to allow freight to start to move, we hope over the course of today is so important. And, you know, I'm hopeful that in the time I've been standing here, there may yet be developments that have taken place. But those will be the things we'll be discussing in both the COBRA and the Scottish Government Resilience meeting. And once we've got a clearer picture of that, we will be able to consider whether there are other actions we need to take in support as well. Michael Blackley from the Mail.
Thank you. Good afternoon. First Minister, you've referred to, in relation to travel, to only travel for the most essential purposes being allowed. Can I just clarify, do the same exceptions that previously existed on travel regulations still exist, or is there a more limited number of journeys that can be allowed? Is, for example, any work-related purpose allowable now, or is it only essential work that's allowable? And for the Chief Constable as well, he referred to the fact today that some people might expect to be spoken to by officers in relation to travel. Can you give a bit more, because you've obviously said that there won't be roadblocks or checkpoints. So what circumstances might lead to someone being stopped and spoken to by an officer? Thank you.
The list will be the same, although we obviously keep that under review. But in terms of work, our advice to people is to work from home if at all possible, and only travel to work if it is absolutely unavoidable. I'll hand over to the Chief Constable on the operational points. Let me say though is that, and I would appeal to the media as well to help us get this message across, because it is for vital public health reasons. Do not travel because it is the right thing to do to restrict travel right now. So don't, as the Chief Constable said earlier on, don't think, you know, can I get away with it and maybe escape getting stopped by a police officer? That's not the right way to look at these things right now. This is about trying to save lives, stopping people getting this virus. So please do it for the right reasons. Chief.
Michael, as you know, the number of circumstances involved in human activity and therefore policing are enormous. But as I said earlier, and I've said really right since March, I expect police officers to use common sense, to exercise discretion, and to use their professional judgment. So by way of example, in terms of when might somebody be stopped, there was a very specific example when officers in Glasgow had seen a van. It was a scrap merchant dealer with a Sunderland address on it, driving somewhere in the south side of Glasgow. So naturally, using power under the Road Traffic Act, they stopped them, asked them what they were doing, and actually they were in complete ignorance of the fact that they shouldn't have been there. They were up there to collect something. So they were issued with a fixed penalty, they were given corrective advice, and they were returned. And other circumstances will be as normal if there's a tail light or somebody's driving erratically, or the car's very full of people, very full of luggage. These issues are all to do with common sense and discretion. But the very fact that you're stopped does not necessarily mean that there will be enforcement flow from that. The circumstances will still be judged by the officers that are there, and if somebody is travelling for a legitimate reason, in their judgment, they will continue. The key thing, the absolute key thing, is not to think about, I might get away with it or I might not. Do the right thing. Make yourself aware of what's required of you, how you can make a contribution to stop this virus spreading.
Thanks. Mark McLaughlin from The Times.
Afternoon, First Minister, Chief Constable. Just to pick up on Michael's point about the travelling, when the Tier 4 restrictions were announced, you said that you would not be seeking evidence of destination or origin. Given that the ante's now been upped with this new variant, is that still the case? If someone says they were at a hospital appointment or visiting an elderly relative who was isolated and vulnerable, will you require evidence now?
Okay, I'll hand over to the Chief on that, but can I just take the opportunity again to say it is absolutely legitimate that, you know, the detail of this is scrutinised, and it's legitimate that people ask all of these questions. I'm not suggesting otherwise for a moment. But it is really important that everybody understands the reason for these travel restrictions is the public health imperative. And, you know, whether you're going to be asked for evidence or, you know, whether you're likely to get stopped when you're out or not, please think about this as your contribution to helping us stem the spread of this virus. I simply cannot stress that enough at this stage. But I'll hand over to the Chief Constable on the detailed point.
Mark, thanks. I mean, I think your question is a fair one and a legitimate one. It does get to the heart of the policing challenge. You know, we need to retain a proportionate response to what's been asked, and the level of intrusion into people's lives, into people's daily movements has to be at proportionate level that does not undermine the consent of the public to their police service. I think really going back, if I recall perhaps even issues you'd raised, Mark, really going back to March or April, about would there be a requirement for people to carry identity papers, or would there be a requirement to people have some written authority to travel? Now, in my judgment, that would be excessive. It'd be disproportionate to the challenge that's been asked of people. I think it would be very contrary to the traditional relationship between the public and the police in Scotland. But when required, yes, there will be a follow-through in terms of some investigation. But the challenge is difficult, and I think your question has focused upon that. But I would still ask for the public to support the police service. We will act in a fair and a proportionate manner. We'll seek to minimise the level of intrusion into private life, just as we would in terms of private homes. But where there's a flagrant breach, we will act. And if that requires a follow-through in terms of investigation, well, that will take place.
I agree 100% with that, both in terms of the policy we're pursuing and how the Chief Constable set out how police are operationally dealing with this. We've tried to sit very much within the culture of policing and law and order in Scotland, but also reflect the fact that the vast majority of people do want to and have been doing the right thing for the right reasons. There are other countries, we've been talking about France for other reasons today. As I understand it, you do need identity papers right now to be out of your house in France under the terms of the lockdown. There's a different culture perhaps around some of these things there, but we've tried to fit this very much within the culture of how we do these things here. I think it has served us well, thanks to the very proportionate and sensitive and sensible approach the police have taken, and thanks to the compliance of the public. It's really important now that we carry on with that, and everybody sees the responsibility we all have as individuals to do the right thing for the collective health of the country. Simon Johnson from The Telegraph.
Good afternoon. Matt Hancock was on the TV yesterday basically saying he anticipates, because of the new variants, that those areas of England in Tier 4 will have to stay there for some months, basically to protect them while the vaccine is rolled out. Would you anticipate that the cross-border travel ban will have to be in place for a similar period? Do you anticipate that the new variants will mean tougher tiers in Scotland, or areas being in higher tier than they otherwise would be? And will it jeopardise the Holyrood election being held in May? Thank you.
I was about to answer that question with a phrase, and before I do it, I'm going to say I'm not referring to the Holyrood election specifically here. I'll come on to that separately. The rest of your questions, the honest answer, Simon, is I don't know at this stage, and I've tried all along, when that is the honest answer to a question, just to give that answer. We are still waiting on further analysis of this new variant. We still have to, the more successful we can be over these next few weeks at suppressing it in Scotland, then perhaps the shorter the time that some of these restrictions will have to be in place. But we have to see how things unfold in the next few weeks. And as I have tried to do for 10 months now, whether some people like it or not, I'll stand here regularly and take people through what we know, when we know it, and what the implications of that are for the restrictions, whether that's level 4 restrictions or travel restrictions or any other aspects of how we're having to deal with that. And I think that's probably a fairer thing to say than trying right now to speculate on periods of time or what might or might not happen over the course of the early part of the year. Obviously, the Holyrood election is due to take place on the first Thursday in May. My hope and expectation, to be clear, is that it will go ahead as planned. I think as far as possible, we want to allow our democratic processes to be unaffected, certainly in the sense that they are not postponed or cancelled in any way. But as you know, we've taken some legislation through Parliament. I think it passes its final stage this week in Parliament, or it goes to its final stage this week, which contains contingency arrangements which are up to and including postponement, but things short of that that would be there if considered necessary. But it's not just the government that can decide on this. The Electoral Management Board and the Parliament as a whole would have to be in agreement to those things. It would clearly not be right and proper for the government to unilaterally decide whether or not an election took place and what the basis for that was. So that legislation contains contingencies should they be necessary, but I hope and at this stage expect that the Holyrood election will take place as scheduled. Christine Lavelle from The Sun.
Thank you, First Minister. A key line in the nerve tag minutes was that the group has moderate confidence that the strain demonstrates a substantial increase in transmissibility compared to other variants. There's been much speculation that there's more to this threat than has been made public. So it was just to ask you, have you been completely upfront about what you know about this new strain? And is there anything significant that the public haven't been told yet?
No, I'm being upfront. I know The Sun finds it hard to believe that, but I am being upfront. I first got told about new strains are identified all the time of this virus. It'll only ever come to my attention if it is a new strain that is causing concern. The Chief Medical Officer told me about this, I think, a week ago today, last Monday afternoon, just literally before Matt Hancock announced it in the House of Commons. At that point, I was told about it because there was a concern that this new strain might be significant. Then I told Parliament how many cases of it had been identified in Scotland on Tuesday afternoon and shared with Parliament what I knew. On Friday evening, late on Friday evening, Chief Medical Officer and I had a phone call after he'd had discussions with colleagues across the UK to be told what effectively is in the nerve tag report, that there was now moderate confidence that this was significantly increasing transmission and that there was significant concern that it was this new strain driving the speed of transmission in London and the South East. At that point, and more of this was shared on the Four Nations call on Saturday morning by Sir Patrick Vallance, Chief Medical Officer, updated the Scottish Cabinet. Also, what was shared was that at this stage, and I've got to stress, at this stage, there is no evidence that it is causing more severe illness, and there is no evidence at this stage that it will undermine the effectiveness of the vaccines. But both of those things are still subject to further analysis, and I am hoping that we will get some of the output of that further analysis even later this week. But that is what I know about this strain. I'm being upfront with people, and I will continue to be upfront with people. It is not in the interests of me or any government not to be upfront, because if this is serious, as we think it potentially is, but if there was any reason to think it's even more serious, then we've all got a vested interest in making sure the public are behaving accordingly to try to suppress it and stop it spreading. But I'll hand over to the Chief Medical Officer, who can perhaps give a bit more detail.
I think that covers it absolutely fully, actually. I mean, the discussions have been ongoing since I learned about this new variant on Monday, and we have taken it through a variety of different committees across the UK as we've examined the evidence that surrounds it. And the opinion of NerveTag was critical on Friday as they looked at some of particularly the transmission data, both in terms of the epidemiology in places where this had been found to be more common, but also in some of the lab analysis as well. And that certainly suggests that this new variant is associated with a higher degree of transmissibility, and the figure that's often been quoted over the last few days is up to 70% more transmissible than other variants. But at this stage, it's really important to set out and be very clear. At this stage, there is no evidence at all that this particular variant causes more severe symptoms, more severe disease, or has any impact at all on the ability of the treatments that we do have against this particular disease or the vaccines that have been developed, that it compromises those in any way.
Thanks. Helen McArdle from the Herald.
Hi, afternoon, First Minister. I just wanted to clarify, I think the CMO had said earlier that the 18 cases were mainly across the Central Belt. I just wondered if it would be possible to get any other detail on whether they're in a particular health board area, and also just whether or not the current situation with this variant will have any effect on students coming back from England to Scotland in January.
We're already, sorry, Helen, did you finish?
Yes.
Sorry, my apologies, I didn't mean to interrupt you. We are already staggering the return of students, and obviously we'll continue to take account of any emerging evidence here, and if that requires to change our plans, we will set that out, but the plans we've set out for the return of students remain as we set them out. When I announced on Saturday 17 genomically identified cases of this, I think 16 of them were in Greater Glasgow and Clyde. The Chief Medical Officer's got slightly more up-to-date information than I have. It's now 18 in total, so I'll hand over to him.
Yeah, thanks. So my understanding at this point in time is that of those the 18 cases that we have in Scotland that meet the case definition for this new variant, all of those are from the Central Belt in Scotland and are spread across 2 board areas. It's Greater Glasgow where the majority of these come from, but there's also a smaller number that come from neighbouring Lanarkshire as well.
Thanks. Conor Matchett from the Scotsman.
Thank you, First Minister. Turning to Christmas, if I may, and I'm asking this question really for an explanation for those people who've had their Christmas plans cancelled, I think for reasons that the public almost certainly fully understand. But in October, Bishop John Keenan was pretty much widely derided for suggesting a Christmas amnesty. A month later, we effectively signed up for one. And then obviously a week before Christmas, that was taken away from those people who had planned towards it. As way of explanation as to how we ended up in that situation, can you explain to us how you ended up, agreeing with a policy that I think Dr. Nicola Steedman said at the time, was reckless, and what exactly you asked for in terms of Christmas relaxation in those 4 nation meetings earlier on in the year, and just how we ended up in this mess where we had lots of relaxations and then suddenly not, when you were clearly not very comfortable with the relaxations in the first place.
Firstly, I'm responsible for my decisions. I don't take decisions and I don't allow myself to get forced into taking decisions that are mine to take. Pragmatism and a recognition of real life. Firstly, I would challenge the fact that Bishop Keenan was derided for that. I think there was commentary about whether the language of an amnesty was the right one, because the analogy was the wartime Christmas Day ceasefire. And I think people legitimately made the point that that's not how a virus operates. But the underlying sentiment that he was expressing was genuine and legitimate, that at Christmas people just find it really difficult, or more difficult, because nobody ever finds it easy, to stick to these really rigid restrictions on how we can interact with our loved ones. And it's that pragmatism and real life. My decisions and the job I have to do as First Minister, and this is probably true of leaders everywhere, would be a lot easier if we were working in sort of laboratory-controlled environments. We're not. We're dealing with human beings, with human emotions and human instincts. We are, although this might be harder to believe, we are also human beings with emotions and instincts, so we can understand that. And I have always been pragmatic, however much I might have liked to just have said all along, you must not see anybody all over Christmas, no matter what. I knew that would be so difficult for some people, that people would decide and decide on different arrangements. And if we simply just buried our head in the sand and said, well, our advice is do nothing, then people would have to come to their own judgments. And instead of 5 days, they might have done it over 10 days. Instead of 8 people from 3 households, they may have had many more than that. So we tried to put some sensible parameters around it, but still advise people that these were parameters for things only if people felt them necessary. And our advice, and I have said this, and Scotland was a little bit different in the messaging after we agreed the 5 days. We said from the get-go that this was something we advised against, if at all possible. It was simply recognising and trying to put parameters around behaviour that we knew some people may feel it necessary to do. And circumstances change. But for this new strain, I would not have gone beyond where I went last week, tightening up some of the advice and the messaging to people. But this new strain has been a bit of a game changer over the last few days, unfortunately, and it's made us all have to sort of think afresh about just the level of risk we are able to take. And that's why on Saturday, with the utmost regret, heartbreak and regret, I had to stand here and say, don't do that on any day other than Christmas Day, and even then only if it is absolutely essential. So, you know, none of this is all, I totally get why sometimes the decisions we're making right now might seem as if they're not entirely logical and rational all the time. We're dealing with a really difficult situation. I also get why some people, even if they understand the logic and the rationale, will vehemently disagree with some of these decisions. That's understandable. But there usually is, almost always is, some, I hope quite a lot of reason and logic behind these decisions. But there is also always the need to be flexible in them, because this virus unfortunately doesn't always behave the way we would like it to behave, and that's what's happened over the last couple of days. Richard Percival from the Daily Express.
Thank you, First Minister. Following the Chief Constable's statement yesterday regarding cross-border travel, do you or the Chief Constable have any figures or an indication on the number of people who have been fined or stopped since Saturday? And also, I know this is a COVID briefing, but I was just wondering, as it was so close to Christmas, what your Christmas present would be for Boris Johnson after he said he would give you hundreds of thousands of tons of fish last week. Thanks.
I don't know, I'm probably not one to talk, but a hairbrush maybe, I don't know. That's meant as a light-hearted comment, not as a serious comment, and I'm definitely not one to talk, as you can see. So I actually signed him a Christmas card over the weekend, so there you go. There is a Christmas card winging its way from me to Boris Johnson. We will wait and see whether there is one winging its way in the opposite direction, and I'll reveal that exclusively, perhaps, in one of the briefings over the Christmas period. I don't have enforcement figures for Saturday. I would doubt if the Chief Constable might or might not, so I'll allow him to respond.
Thanks, First Minister. Very briefly, we will publish figures, Richard. We've been really clear on that from the outset. Obviously, there's always a lag in terms of enforcement activity, and then our ability then to collate that and report publicly. Certainly over the weekend, we continued to take enforcement action, issuing fixed penalties in all circumstances, not least of all house gatherings, to be honest with you, still remains an issue of real concern. In terms of the travel regulations overall, we've issued over 90 since they came in to being. And again, initial cut over the weekend, I think there was around half a dozen issued. But again, I couldn't give you sort of absolute confirmation around them. But fixed penalties will be issued when required. But we'll continue to do that. The approach that we've taken from the outset of always enforcing the law when required, but primarily seeking people to do the right thing. But again, rest assured, we will publish figures because we've done that right from the outset.
Thanks to the Chief Constable and thanks also to the Chief Medical Officer. My thanks to Jill for our BSL interpretation and to all of the journalists, and thanks to you for joining us. We've managed to finish with 2 minutes to spare, which is good. Can I just use maybe 30 seconds of those 2 minutes to give you a look ahead to the week? I will give you tomorrow's update in a statement to Parliament at 2:20, as I normally do now on a Tuesday, and I'll obviously set out any material updates from what I've told you today. On Wednesday this week, I will also speak to you from Parliament at 12:20. I will give the update there, and then the weekly session of First Minister's Questions is on Wednesday this week. As things stand just now, and obviously this would change if there were any developments that merited it changing, but as things stand just now, there will be no daily briefing here on Thursday, Christmas Eve, or on Friday, you'll be happy to know, Christmas Day, or over the weekend. The next briefing from here is likely to be in the early part of next week, but we will make sure that is notified. Obviously, we're in a very fluid and changing situation right now, so if there are things that I need to share with you, talk to you about or set out, then we will make these briefings available and we'll notify those in the normal way. Let me just end by thanking all of you again for all of the really difficult things you're doing. I know how difficult they've been all along, but I am acutely aware that this week and next week they're going to feel even more difficult than normal. And, you know, that is very much in my thoughts and everything we're doing. I know that there's people who are going to be spending Christmas alone without loved ones or with just very small numbers of their own family, without the people they would normally want to spend Christmas with. That's true of all of us, and I'll be thinking of everybody in that position. We will get through this. It's really, really tough just now, but we'll get through it quicker and I hope more safely if we all stick to all of these things that we're being asked to do right now. That means abiding by the travel restrictions, it means staying out of each other's homes, it means following all of the facts advice. So miserable though I know it feels right now, please do that, and then hopefully 2021 is going to be a year that brings brighter times for all of us. So I'll see you in the Scottish Parliament, from the Scottish Parliament tomorrow, and in the meantime, thanks for joining us today.